Hi everyone, it's board certified plastic surgeon Sean Doherty in Boston, and today's video request is from someone on social media who specifically asked what can be done for saggy under chin area in a woman in her 50s. So obviously I would need to see this woman in her 50s to be able to assess what's going on and give appropriate recommendations, but let's talk about that in generality. Saggy skin in this area could be addressed non-surgically and surgically. You know, I'm a surgeon, and so I always like to think of things in a surgical way, and I like to discuss them in a surgical way. Not everyone should have surgery, not everyone can have surgery, and not everyone will have surgery. But I like my patients to know what the extreme option is and what other options are. So non-surgical ways to address laxity is another word of calling sagging skin in this area is topical treatments. So those could be something done with an esthetician. And when I think of sagging skin, I think of ways to tighten it up. And though this is not a cure-all, the procedure TempSure, TempSure, is a radiofrequency platform where an application is placed on the skin and heat is placed or created, and heat is associated with skin tightening when it's the temperature of the skin is brought up to a certain level, and we know that's stimulatory and again associated with skin tightening. So that's the TempSure device. It is done in series, so multiple treatments are needed. It's a little warm, there's minimal downtime, it's done by an esthetician, and it can have a moderate improvement, and perhaps that's what's gonna help somebody. The next thing up is combining that concept of radiofrequency, but with microneedling, and that device is called Profound, and it is a device that I can apply along here. And it looks like a staple gun, actually. And it's a combination of 5 pairs of needles that go through the skin, placed underneath there. That needling component actually is stimulatory. And if you know anything from listening to me, stimulating the skin creates an improvement. And then the addition of radiofrequency contributes to some skin tightening. So I can do it along here. It has about 3 to 5 days of downtime. It looks like you were attacked by bees in this area, and there's pinches and small red marks from the needling and swelling. And ultimately it takes about 3 months to see the benefits of radiofrequency. So you do have to be sort of patient for that. That device can also have a specific modality added to it and performed along this area, that the needles are actually placed a little bit deeper and they go just below the surface of the skin into the subcutaneous tissue, and that's the tissue that's underneath the skin itself, and that usually contains fat. And so we call that the sub-Q application of Profound, in a combination of the superficial, so the device more on the surface of the skin, and the deeper can create kind of a nice non-surgical improvement there. The laxity or dragging down of the skin also contributes to that sagging that my patient was complaining about. So a way to lift this up helps that. Threads, you all know that I'm a proponent of threads in the right patient for the right issue. So those can be placed along here to help bring this up here. The next step up could be actually removing what's causing some of that sagginess. So that's liposuction. So liposuction is a way for me to remove fat in an area and then see what happens. So I don't mean to be lackadaisical when I say that, but you have to see what the skin will do once the fat is removed. So say someone who's not in their 50s, but maybe in their 20s and the 30s, if they have extra volume in this area and they're bothered by the fullness of their neck, then liposuction could be performed, and one would anticipate that skin to tighten up a little bit because that patient is in their 20s and their 30s. As we get into our 40s and 50s, the snapback or elasticity of our skin is not quite as good, and we can't rely on it as much. So simply removing fat, so taking the fat out with liposuction, is not always going to be the end-all result or create the end-all result. One could add to the liposuction radiofrequency, which I just mentioned. It'll be a little bit more of an invasive way of performing that, and I would use what's called the Renuvion or the J-plasma technology to, with the assistance of helium, and create a heat response underneath the skin. So after I'm doing liposuction, and that contributes to skin tightening. I skipped over one non-invasive way of addressing volume here, and that's Kybella injections, and that's a deoxycholic acid. That's an injection of medicine that helps break down fat. It's done in series, and it can safely be done here and even along this jawline here. I like it. It's a nice treatment. I've done it successfully on myself. It requires a lot of treatments though, and each treatment has swelling. So there's a little bit of a downside to that. So lastly, what I would tell that lady in her 50s who's complaining about sagginess underneath her chin is to consider a neck lift, okay? So that's the surgical intervention. That's an incision around your ear, lifting up the skin along the lower face and along the jawline and even some of the neck, revealing the muscle that's underneath that has sagged down. I'm able to tighten that up with sutures and then trim the excess skin. What's nice about that treatment is that can be combined with liposuction to this area, which can truly sculpt the neck and lower face. So if you're describing a turkey neck or a significant hanging of tissue of the lower neck, surgery is probably your best option. All right, guys, I hope that was helpful. Please stay tuned, see my Instagram, my YouTube channel, and continue to follow for these videos. I hope everyone's doing well. Thanks.